But because of the policies, rules, and regulations in the developed countries, taxation and others and adverts, tobacco use in those countries has dropped. So it's new in Africa, and people are moving their companies to establish themselves in Africa. Hence, this resource center comes at a time when it is still early, that we can be able to control, prevent, and mitigate the spread of these diseases throughout our people. This center will be supported by Bill Gates, through WHO. So the grant is actually from WHO, funding from Gates, and it will be 3.5 million the initial 3 years. And in these 3 years, we will try to establish ourselves to advise governments in the region, the 5 countries, to be able to put in place policies. And these policies are aiming at the World Health Organization Framework Convention on Tobacco Control, of which Uganda is actually a signatory. If it wasn't, then the resource center most likely wouldn't be here. To add on to that, Uganda was also selected as the beneficiary country, not only for the school supporting it, but Uganda is also receiving another substantial amount, so that the programs we run in the center, Uganda can actually buy them out. They will not be free. Buy them out to implement them in the country. And the goal for the resource center, I must say, is to prevent further increase in the prevalence of tobacco use across African region. Now, one thing that is very important for you to note, and the press, and I know this is what you quote, is that we are going to stop people who sell cigarettes. No. Our intention is to create opportunities, educate the masses, the communities, and educate even the producers of tobacco. How can we prevent ill health to our people? One of the things that has been achieved worldwide is to increase taxes on tobacco products, 1. 2, increase advertisements against tobacco, telling people how tobacco kills, and this will be our role. You all know very well that HIV, the success was on adverts, but you know that only a small label is on our tobacco cigarettes showing that tobacco kills. If we can go higher and people understand. The other thing is to find alternative sources of income for the people who produce tobacco plants, so that we reduce tobacco consumption from the base, knowing that people keep growing tobacco because they have to earn a living. So if we find alternatives for them, so we are going to work with scientists to find what else can people do, what else can people sell, how can the government increase resources. 1, increase resources which they can plunge back into health, and tax these tobacco companies. And the last thing is, how does the university benefit from this? The university will benefit by creating a center of excellence for the whole of Africa. Although we are starting with 5 countries, we will create a center of excellence that can train all the other countries in all methods and policies that we can put in place. And the second thing, the university will be seen, or we will work closely with the government as a university to cause change in policy. Change in policy of all the things that I have said. And the third thing that the university will benefit is causing impact on the communities who grow tobacco. And the fourth and last one is cause change on the health indicators for this nation, knowing that most of these diseases are actually preventable, those which are caused by tobacco consumption.